Hello and welcome back to another new edition of Windows and Current Affairs. And today, of course, we're going to embark on a very important topic that brings joy, that brings pride. And of course, it's a very optimistic piece of news, especially to people in health sector and to Egyptians at large. The news is, of course, it's becoming old news to everybody who is living in Egypt, as of course, Egypt is registered among the top countries that achieved the golden tier status on its path to the elimination of hepatitis C. Of course, this would enable Egypt to be able to be free from hepatitis C once and for all, curing almost 90% of the patients in the past 3 or 4 years or 5 years. That would enable Egypt to go to a whole new level. We're going to be talking about that in detail. How did Egypt and Egyptian doctors and the people in the health sector, of course, monitored by the government and by the continuous and very intense follow-up by the president himself, directing some presidential campaigns also to boost and empower that continuous effort. We're going to be talking about that in full detail, and we're very delighted to be having with us someone who could talk to us in a better way about that particular piece of news, Dr. Islam Anan, lecturer of pharmacoeconomics and health policy. And of course, this is very good news, Dr. Anan. Let us first talk about the origin or the foundation of that huge step, that mega step taken by the Egyptians. It's not only by the health sector, we believe.
Yes, I totally agree. First of all, thank you, and it's always a pleasure to be in Windows.
Our real pleasure.
Thank you, Ms. Dina. And actually, it's exactly like what you were saying in the introduction. It brings a lot of joy. It's unprecedented. It's first time that a country to achieve a gold tier in the elimination of chronic hepatitis C. And it's actually a demonstration of the using of the right tools to screen, diagnose, treat, follow up, and achieving a good clinical outcome. And the story actually began in 2014 or even before 2014, when we thought of how can we eliminate the burden we are having as Egyptian citizens from chronic hepatitis C, either clinically on the person himself or economically on the country. And we are talking about a silent disease. Unfortunately, 80% of any hepatitis C disease patients will live unaware that they have the disease itself. So we are talking about 80% of people having hepatitis C, they have the virus, they don't know, and
completely unaware of
completely unaware, there is no symptoms, and suddenly they discover when it's too late, and it's becoming with a high prognosis and a lot of manifestations, a severe case, and sometimes and many times it goes on till liver cirrhosis, sometimes for liver cancer because of the late diagnosis.
Very dangerous.
Yes, and another aspect, we were actually having a lot of burden from people who would like to travel abroad and work in the Gulf areas, in Europe and so on. And they only discover they got the virus when they are finishing their documents for the work permit before their travel. So imagine someone...
Through the tests?
Through the final test before traveling. So for example, we've seen it a lot. Students who graduated do a first interview for a Dubai job, for example, second interview, third, and he got accepted. He's very happy. He's trying to prepare his documents to travel, so he's gonna work there, and at the final step,
they discover it.
He discovers that he got hepatitis C, and all his dreams are actually now
aborted.
Vanished. Yes, aborted. So we're not going to be able to travel ever again, even if treated. We had another.
Why is that?
Because unfortunately, most of the Gulf countries, they refuse anyone to work there if they got a positive antibodies for the virus.
A former positive, but once he is cured?
Still so far, even if cured, their body will have antibodies. It's like COVID. We have antibodies after recovery, and they test only for antibodies. And when there is antibodies, they refuse the visa. And currently, the Ministry of Health is communicating with the GCC Health Council to try to erase and change a little bit or amend the terms and conditions so they can accept again recovered cases or healed cases from hepatitis C. And there is another burden we had 10 years ago, which is the cost of treatment. One patient to take a treatment for hepatitis C, the antiviral itself, it costed around 100K, 100,000 Egyptian pounds. And we are talking at 2010, 2011, till 2014, which is a very high cost. And the success rate and the response rate was around 50%. So it's a very expensive medication per patient. The response rate and the
Not
success
everybody
rate.
can afford it, especially the
Yes.
low-income bracket.
Even from government perspective, a lot of patients were covered, but still the response rate was 50%. 50% response is very low percentage with a very high actually adverse events. Till 2014, which is a turnaround for the full story. There's a committee, the Committee for the Hepatic Viruses and Diseases. They decided to negotiate on the Sovaldi case. And all of us, we remember what happened in the Sovaldi case. We took it here in Egypt by the procurement departments by 1% of its global price. And that was the first step towards having a good plan for eradication. Because currently we are treating one case with 3,000 Egyptian pounds. 3,000. We're talking from 100,000 to 3,000. And at 2018, at the 100 Healthy Lives Presidential Initiative, President Abdel Fattah al-Sisi announced the launch of the presidential initiative to eliminate hepatitis C in 3 years, to identify, early detect, screen Egyptian citizens for hepatitis C and then treat it. And since the launch, and actually with the political will and the support we had from the presidential office and President Abdel Fattah al-Sisi, the 100 Healthy Lives started to target 65 million Egyptian citizens. They want to actually screen 65 million, and that was a very ambitious target. It's very hard to reach almost most of the adult population. And for that, a good policy framework was actually designed. You need to prepare for resources, for a lot of processes to change the whole
to be able
healthcare
to
structure.
stand up to this danger. But
Yes.
before we get into that, of course we can figure from what you're so kindly elaborated on that the health presidential campaigns were the first solid foundation that created that path of success. We can't help but give him credit. But at the same time, we need to know, we normal people need to know, are there any symptoms that we can notice for someone who might be diagnosed by hepatitis C? Another question, is it infectious? And if it's infectious, how can we be able to protect ourselves? I mean, there must be rules or precautions or any type of information so that we can, prevent it from the beginning. So if we could embark over this particular area.
It's a very good question because it started with the infectious part. It's very infectious and it infects through blood. And the breakthrough of hepatitis C and why in Egypt we do have the highest prevalence of hepatitis C worldwide, it's because of the campaign we had for bilharziasis. And because the injection routine and the injection regimens we had doesn't involve a safety aseptic injection, and people were even donating blood without testing for hepatitis C because we didn't know back then that there is a hepatitis C.
That was when? Back then, 30 years?
Yeah, no, more than for 30 years as well. So hepatitis C virus was transmitted through blood bags, through injection, and still was infectious even through blood during shaving. If someone is actually shaving at the barber shop, dentists, and if we are not following a good regimen of hygiene and aseptic conditions at barber shops, especially countryside, and at dentist clinics, we'll continue having this infection from a patient to another patient and so on. And that's why the rule of thumb of preventing hepatitis C before the presidential initiative and before having the screening is to make sure that we don't have any dental clinic with the virus. We do have an autoclave to actually make sure it's an aseptic tools. We're not using tools from one person to another. Same for the barber shops in the countryside and in all places that we can actually...
That means that we should have some type of surveillance by the government from other sectors of the government.
Yes, and that's how we actually got the prevalence. When we mentioned that 7% of the adult population of Egypt had the virus, that was actually from the surveillance, from the research. And 7% is actually huge. This is the highest country worldwide prevalence for hepatitis C. And we knew it because of the surveillance, the epidemiological surveillance across all the governorates. For example, in Kafr al-Sheikh itself, only Kafr al-Sheikh, there was 1 million case. So it's a very huge, that's, to tell you the percentages, worldwide we only have 65 millions infected people with hepatitis C. In Egypt we had like 5.5 millions, only Egypt. So it was the highest country. And once we stopped the use of tool inside barber shops, dental clinics, and we actually tried to enforce the hygiene and better hygiene in terms of the primary care clinics, in terms of using a tool from a patient to a healthy individual, the incidence started to drop. However, the response rate and trying to having the patient in a better condition was not that good because of the treatment. The treatment was a 50% success.
Very costly.
And very costly. And to achieve it, you need good financial resources. You're not going to be able to do it for good financial resources having the treatment per patient exceeding 100,000 Egyptian pounds. And starting 2018, when they started, they put all this in mind, the preventive thing, which is we are trying to do an awareness campaigns, educational campaigns to all healthcare professionals, to all the blood banks. Of course, they are currently screening all patients donating blood for hepatitis C and HIV,
because this is the root cause.
Exactly. And we need to treat and stop infection for the current cases. For the current cases, and because the target is to screen around 60 millions, which is a high target, you must do it a multi-channel communication approach. So they started the Presidential Initiative Office in the Ministry of Health, and with the support of the Department of Public Health there and the Minister of Health, Dr. Khaled Abdel-Ghaffar, and all the ministers before him. They started to put the campaign in the primary care clinics. So any patients entering the primary care will test for hepatitis C. The 100 Healthy Lives were mobile across all the governorates and countryside through caravans and health caravans, so patients can actually measure blood pressure.
They can check in and get...
check in for diabetes, blood sugar, and make the HCV test. Even through media, TV, through internet, they started to make a big awareness campaign that go test for free. It's for free. It's for your blood pressure, for your diabetes, and for HCV. It's not only HCV. So you decrease the taboo of Egyptians if you're only going to say, go test for HCV. So it's a less tension in that way. And actually, in 18 months, the Egyptian government and the Minister of Health reached 63 million Egyptian
in only
citizens.
18 months?
In 18 months.
We stayed for almost 30 years. We couldn't do anything. In 18 months, typical President Abdel Fattah al-Sisi's system.
Yes. Even before the due date was actually 2.5 years. And that was the first step.
It's amazing.
Yes, it's amazing. It's a one of success stories, and actually, it's the highest screening ever.
Not too many people know that, by the way.
And hence we are here, I guess, talking about it.
Amazing. It's magical because sometimes, I mean, people are criticizing sometimes, especially the Ministry of Health, and I mean, asking for more elaboration, for more effort to be spent, especially at pandemic times and everything, just like any other country. But nobody takes from his time to find out that we were able to eliminate the virus in only 18 months, and at the time we stayed for 30 years or more, maybe 60.
Yes,
right?
you decreased the prevalence from having a 7% to having 0.38%.
So it's almost none.
It's almost below 0.5% as well. So having said that, and a lot of success story actually is in the hepatitis C, because we are talking about thousands of healthcare professionals, either for screening, we are talking
and vision
about...
also.
Yeah, the good thing about any presidential initiative, if we wanted to succeed, is to have a very clear key performance indicators and vision. Having outcomes, having key success factors, and you can be able to measure the success and quantify it. This is very important. I have milestones, very clear cutoff points for milestones.
Right, which leads us to the policy framework. We were talking before the episode, and you referred to the fact that policy framework is the foundation of anything. Once there is a policy framework, everything is going to be achieved even before its due time. And everyone would know his mission, I mean, his assignment.
Exactly.
Sectors are assigned by certain missions, and they have to execute it, and it becomes so organized. So if you'd like to talk to us about the policy framework.
To have a good plan, you need to have a good policy framework, exactly as you mentioned. And
in what sense?
To build a policy framework and to make it simple, it means that you have a clear strategy on what you want to achieve through the presidential initiative. The multidisciplinary team assigned to the presidential initiative wrote down what they need from resources perspective, for example. And from resources, it means that the policy framework must define the human resources we need for success. We need to train the healthcare professionals, the physicians, on how to diagnose, on how to read results. We need to train nurses. We need to train individuals who are going to just take the key demographics of the patients and register them on the system. We need as well a good technological resources. We need a good IT infrastructure. Hence, there were a platform implemented for the presidential initiative where patients can actually put their contact detail, and then they will receive a contact SMS message to go and make the lab test. They will go for confirmatory test, starting if they are positive to take the treatment or another actually platform. And the central location in the Ministry of Health will be able to aggregate data, generate insights, and they can track cases day after day. We need as well for resources, a good financial resources. We need to have a very good tools in terms of medications, and hence Egypt started to communicate with the local plants here in Egypt to manufacture all the treatments to be made in Egypt. And that was another actually news to celebrate, that all the treatment for hepatitis C is actually locally manufactured by Egyptian manufacturers. And the screening tools, we need to purchase screening tools with the most efficient price, the diagnostic procedures, and the monitoring tools as well.
But the medication was manufactured?
The medications, all of it, 100% of medications were actually locally manufactured by Egyptians.
So this is the first time in Egyptian history that we manufacture this hepatitis C medicine, right?
After Sovaldi, exactly after Sovaldi. Before Sovaldi, there was no Egyptian medications. It was all except for a very minor production from a local company, and it was not that successful.
And that's
after
why
Sovaldi,
it was a big
very
hassle.
Expensive, big hassle. After Sovaldi, a couple of months, in less than 1 year, the Egyptian manufacturers started to manufacture the medications, which is same efficacy like Sovaldi. We are talking about medications with a 97 to 98% success, which is a very high percentage.
Amazing.
And once you do have the resources, the financial, we mentioned human resources, we mentioned financial resources, technological resources. We do have currently the diagnostic, the treatment, the monitoring tools. You need to have a good processes. And that's the second thing in any policy framework. How can I make sure that the patients are going from their homes or the subjects to get screened, to be screened? If positive, how are they going to actually go to start their treatment? And if they're going to go to start their treatment, you need to make sure that they complete the course of treatment and there is a positive outcome. Hence, you do need a call center, and a call center was established. We're going to call the patients to follow up. All these steps are done, and if the patient drop out and he didn't go to get his treatment, they're going to call him, and that actually happened, and tell them, please, you do have a dose, the treatment is for free, everything for free. Make sure that you continue your medications to make sure that you eradicate the virus from your body. And after the call center, they receive all the treatment and their data will be on the system. And hence, the most important part in the policy framework is the outcome. How can I make sure that I do have a good research infrastructure, that I can track the clinical outcome and make sure that I am actually tracking and tracing every single patient on the system itself to make sure that I reached a success factor which is beyond the benchmark I'm actually seeking. And talking about that, you mentioned the gold tier, for example.
Before the golden tier or the gold tier, are we talking about monitoring around like not 100 million but 90 million the population? I mean, talking to people.
We actually, the Egyptian government screened 63 million.
63 million?
63 million
so
citizens.
Targeting 63 million, talking to them over the phone and following up.
You will not talk to all of them, because if the patient or the subject is completely healthy and he's far beyond the virus, it's okay. They will be actually sent home.
Until we could find out, we have to talk to all of them.
We screened all of them.
Oh, we screened all of them.
We called, we identified from the 63, 4.1 millions. There was 4.1.
Which is a hefty number.
Yeah, of course it's a hefty number. And 4.1 is huge because you need 4 million people to make sure that they are receiving their treatment, they complete the course of treatment, and you do have a positive outcome. And if any patient of them will drop out of treatment, you need to recall them from the call center. So the call center, we're calling the dropout of patients from the treatment itself. But all of them, the 4 million, they were on the online platform, on the digital platform. And from the digital platform, you can take another vital and important clinical data, which is maybe these patients are going through a liver cirrhosis. And
is that related to the same? I mean, is it a side effect?
It's a deterioration of the case itself, being a late diagnosed, because you know it's a viral hepatitis. It's affecting the liver, and the liver can be actually deteriorated more to reach a level of cirrhosis. And cirrhosis is more like failure, and after that it can be actually a liver cancer, hepatocellular carcinoma, what we call an HCC. And to make sure that we are not only treating HCV but also the complications and the consequence of the HCV, another presidential initiative was actually launched only for liver cancer, talking and calling all the patients that are eligible for the screening, having liver cirrhosis or having anything in the liver, to screen for liver cancer. And if diagnosed with liver cancer, they will be put on another treatment campaign.
So this was the stage 2?
That was stage 2 of the campaign. And the campaign identified 60,000 patients with liver cancer that they need treatment. They were not going to be discovered if there is no presidential initiative.
Of course.
We would have left 60,000 Egyptian people living with liver cancer who will actually diagnose or discover at a very late stage. A stage when treatment will not going to be
which would have affected the initial campaign, the hepatitis C, which means that the planning is very important. It's even equally important to the health plan.
Yes, without planning, you don't know where you're heading. You don't have a clear vision. So your milestones,
you will drop some important issues.
You're going to drop the success factors.
Success factors.
So, for example, the gold tier you mentioned in the introduction is a success.
Let's talk about the gold tier.
Is a success factor. Is a target. So, in order to measure your success, you need to have a target. WHO put a target to countries. If a country would like to eradicate virus C, what we call a gold tier, a silver tier, and a bronze tier. Gold tier, it means any country who can achieve 80% screening and achieve 70% treatment. We actually in Egypt, we achieved 87% screening.
Almost 90.
Almost 90, and we achieved 94% treatment. So we are talking about even standards higher than the gold tier identified by the WHO.
And not in any country's wildest dreams. They could have reached that in only 18 months.
Yes, exactly. And to tell you about the gold tier, we are the first country to get it.
The first country.
No other country worldwide took the gold tier so far. So
That's great.
the WHO and the WHO Director General mentioned that Egypt is actually a standard case study to other countries. They would like to eradicate virus C as well, that they can adapt the policy framework.
The Egyptian experience.
Exactly. You can adapt the policy framework that Egypt did to another country. And hence, for example, Africa is trying currently to mimic or do a similar program, and we are helping African countries through another presidential campaign.
You also talked about another effort or another third stage. I mean, after we have took that leap in that particular domain, we turned to our brothers in Africa, and another campaign was launched.
Yes, treating 1 million African from hepatitis C is another presidential campaign. We are talking about a campaign targeting African countries where Egypt can help by screening procedures and protocols, by the processes itself, and help by medications. We currently produce the cheapest and with a similar quality medications for hepatitis C, so we can have a good trade in that. In the training and the capacity building and capability building, to transfer the technology and our knowledge in terms of elevating the capacity of early detection. How do we make screening? How we encourage citizens to go and actually get their screening for free. For example, there's a lot of tricks, like I was mentioning. Don't just tell people there's a hepatitis C screening. They are not going to go. But you tell them it's a health check. You're going to go test your hypertension, test your diabetes, and your hepatitis C or liver function. Put it mandatory in terms of legal paperwork. When they're going to finish their legal paperwork, just put a clinic where they need a certificate that you are clear from virus C before completing your documents.
That's an amazing idea also.
So a lot of ideas were made that you can teach and transfer to another countries. And this campaign actually succeeded, and it was declared with the results during the Africa ExCon conference early this June 2023.
And of course, like we earlier talked about, which is the presidential follow-up. I mean, that particular, the foundation of all that, story of success was taken by the president himself. He directed the presidential campaign to start to monitor, and you went on with the rest of the story. But then there was a sincere and precise follow-up by the president.
Yeah, that's correct. And
we remember.
We can all notice during the conferences and even during the last conference, President Sisi was actually asking on the campaign, and he was following up the figures and numbers. And when the launch even of the campaign happened, it was by the President Abdel Fattah Sisi that it was the main aim of the Egyptian country that we would like Egyptians to have better health. We're not talking about treating patients. We're talking about trying to make Egyptians of better health. They're not going to be patients anymore. And hence the Vision 2030 of health was emerged. It was emerged as a people-centric, not patient-centric. We would like people to be more healthy, having more preventive measures. And hence, for example, we have as well a smoking cessation campaign, a healthy diet campaign. These campaigns are not targeting a disease. It's targeting a prevention or enhancing the immunity of the Egyptians, so they were not going to have diseases anymore in the future, like hypertension, cardiovascular diseases, which is the #1 cause of death, for example, for Egyptians. And we can even notice that the gold tier itself, it was handed to the President Abdel Fattah Sisi himself, because he was leading the campaign. The buy-in is a very important aspect in any public health initiative. It's very important. Without political will and without political support from the President, it will be very hard to put all the resources of the country to serve one goal.
Yes.
For hepatitis C, you need the Ministry of Health, but not only the Ministry of Health. You need all the other ministries, the Ministry of Education, Higher Education, the Ministry of Planning.
Ministry of Communication and
The Ministry of
Technology.
Communication was actually giving the platform for the digital platform. And we need as well a lot of effort from authorities. We need an effort from the Unified Procurement Authority, from the Egyptian Drug Authority, from the
Planning
Bahar
and
Authority,
Development.
Planning and Development. So we are talking about a multi-sectorial efforts, as well as international organizations like the UN agencies and the WHO. So putting all these authorities and ministries all together to come with one vision and one goal, and we can see them working in 18 months to achieve the goal, it needs a centralized mind to put a clear vision to all, that you all need to work on these key performance indicators in a good timetable, and I need to see success every 3 months or 6 months to make sure that I'm going towards the right path. And that was actually happened during the HCV.
Right. We're going to be continuing on that story or success story that Egypt has achieved in only 18 months, but right after this short break, so stay with us. Welcome back, and we're still with Dr. Islam Anan, lecturer of pharmacoeconomics and health policy. And Dr. Anan, it feels great, and it feels a lot of pride, we as Egyptians, when we talk about ourselves. I mean, we are sectors. I mean, we are the media sectors, you are health sector, and there is the presidential sector, and like you kindly mentioned, the other sectors. It's a great achievement. No other country could be was able, amongst the power balanced countries and power countries, developed countries, all that, they couldn't achieve it. So it's a real story of success, and when we talk about it, we should also talk about it from all, sides of the story, like you kindly is elaborating right now. Talking about this campaign, after this step or successful step, probably there are other, the story didn't end at that level. There are other, successful steps that should be taken. What are these steps?
Yes, and just to second what you are saying, it is a success story that all of us need to be proud of, especially the multi-sectorial, especially the teamwork happened. We're talking about thousands of healthcare professionals, thousands of administrative personnel working all together. And it put us on the right pathway towards having a better preventive health and medicine and better health for all Egyptians. And it's not only about hepatitis C, and it's not only about liver cancer campaigns. We're talking about 14 presidential initiatives for health. And most of them are targeting the same story, targeting the Egyptian citizen from birth till senior years. We're talking about presidential initiative for genetic disorders for newborns, about hearing testing for the newborns, for all the school children, anemia, stunting, with a short stature, and obesity, for example. We're talking about even nutrition strategy for the youth. Non-communicable diseases like hypertension, diabetes, and cholesterol. We're talking about breast cancer and women's health, all oncology and cancer presidential initiative. We're talking even about mental health presidential initiative and autism. We're talking about the first 1,000 days of the child time and for senior year. So we are actually taking the journey of the Egyptian citizen and trying to make a lot of preventive presidential campaigns to promote better health. And for each milestone or for each pillar in his life, we would like to promote a good health strategy. Eat better, move more, try to avoid bad habits, try to have better health, and you will have less consequence in the future. You will have less cardiovascular attacks. You will have less hypertension incidents among the Egyptian citizens. And that's what gonna lead us to the main aim. You mentioned a very important thing in the beginning, which is the clear vision. What's our vision? The vision and the 2030 vision is better health for all Egyptians. The vision was not to treat patients. It's not about having more hospitals. Having more hospitals or treating patients, it's a good cause. But having healthy individuals, it's always better. having a citizen who doesn't have to go to a hospital
Of
is
course.
better than having a hospital.
Of course.
And it's not an easy task.
It's a better plan. I mean,
it's a better plan, but it's a very
modern planning.
far-fetched, and it's hard to achieve, of course, than being just a patient-centric. And it needs a high infrastructure that you need to split the Ministry of Health from all the burden of the administrative burden and focus only on that. And that's why you will find that the Ministry of Health currently is mainly focusing on public health, focusing on health policy, focusing on the presidential initiative. And for example, all the drug registration, pricing and so on went to the Egyptian Drug Authority, moved out from the Ministry of Health. All the procurements moved from the Ministry of Health, and you have now the Unified Procurement Authority. The quality and accreditation moved to another authority. So now
That's
you have
good
a better
governance.
governance. You have better governance, better focus, that the main aim of the Ministry of Health is not administration and bureaucratic anymore directions. The main aim is promote health, execute the 14 presidential initiative, and even it's going to be more presidential initiatives till you reach by 2030 having a universal coverage for all Egyptians and better health indicators. By health indicators, I mean the incidence of diseases will be less because you are promoting better health.
Will decrease. And at the same time, we wouldn't be in need for more hospitals.
Yes, if you achieve a better health,
Of course we'd have hospitals.
You will balance your need. You will balance your needs to hospitals.
Yes, that's a better phrase. Unfortunately, we ran out of time, but we feel a lot of pride talking about only one success story. But we would hope that we could continue to cover the rest of the success stories on a promise from you that we could...
It's always a pleasure.
It's a real pleasure to be able to explore together this or take a flashback into all the steps of this success story and, I mean, reflect it to the viewer. Because it is very, very optimistic to talk about. I mean, Dr. Islam Anan, you're a lecturer of pharmacoeconomics and health policy. We'd like to thank you, sir, so much. Wish you the best of luck. Thank you so much for coming.
My pleasure.
A real pleasure. And I guess this brings us to the end of this edition of Windows and Current Affairs. Many thanks to all of you. Until you see you again next week, that's goodbye.